Mrs. Princey, Associate Professor in Mental Health Nursing. A relationship is defined as a state of being related or the affinity between the two individuals. If you take the healthcare system, the nurse and the client interact with each other. They are having a professional relationship with the goal of assisting the client to understand his personal resources to meet his unique needs. So you understand the importance of the therapeutic communication and the relationship that the nurse and the client has, so that is the service from the nurse's end is being delivered effectively. So today I'm going to talk about a topic which is known as the therapeutic nurse-patient relationship, or we can say therapeutic relationship. Before going to the topic, let us see the types of the relationship. So if you take in general the types of the relationship, we have got mainly three types. So one is the social relationship, we have got the intimate relationship, and third one which is the therapeutic relationship. So what do you understand by the social relationship? So a social relationship is basically initiated with a purpose of enjoyment, friendship, or socialization, and also to accomplish a particular task. So that is a social relationship. So in the social relationship, there is a mutual understanding between the members of the group. We can say that the mutual needs are met in the social group. For example, the participants share their feelings, their ideas, as well as the experience when they are in the social. The second part or the second type of the relationship is the intimate relationship. What do you understand by the intimate relationship? Intimate relationship is a relationship between two individuals who are having an emotional commitment with each other. So you can say, for example, the relationship which is between the husband and the wife. So whatever the relationship that or the commitment which is there, so it is a realistic feeling that they share with each other, or the reaction which happens in a natural way. So that is an intimate relationship. So usually this intimate relationship between the two individuals will help them to understand each other, to make sure that they meet the another individual's needs effectively, so that they will have the growth and the satisfaction in the relationship. So that type of a relationship is called as the intimate relationship. The third type of the relationship, which is very important here, is a therapeutic relationship. So in the therapeutic relationship, the nurse will use her communication skill, or she will do the interaction, and she will try to analyze the human behavior, and she will use her personal strength, so that she will be able to bring about the growth and improvement in the client. The focus of a therapeutic relationship is on the patient, wherein the patient will share or try to ventilate his feelings, his experiences, and beliefs, or the values. So these are the three important types of the relationship. So one is the social relationship, the intimate relationship, and the therapeutic relationship. So let us see what are the goals of the therapeutic relationship. So number one is it will facilitate the communication of feelings of distress, distressful thoughts, or the feelings. So when the nurse and the client, they communicate with each other, they have developed the rapport, the client will be able to express his thoughts which are very disturbing to him, or distressing to him. So he will feel that comfortable space to ventilate or share his thoughts or feelings when they are having a good therapeutic relationship. That is goal number one. The second goal is assisting the client to solve the problem. So problem solving is another important goal of therapeutic relationship. When nurse analyzes or tries to find out what are the problems of the patient, she will help in the problem solving process. The third goal is to help the client or assist the client to examine the self-defeating behavior or thoughts and also test the alternatives. It will help the client to analyze himself, to understand the behavior which are hindering him. Okay, so self analysis, it will help out. And also, what are the alternatives for these kinds of the behavior or thoughts which are very negative in the client? So that can be done when there is a therapeutic relationship. The next one is promoting the self-care and the independence. So when the client and the nurse, they are working together, so at times the nurse will encourage the client or motivate the client to meet his own self-care needs and to develop the autonomy or the independence to carry out or solve the problems by himself. That's a very important goal in the therapeutic relationship. So moving on to the components of the therapeutic relationship. So we have got four important components in the therapeutic relationship. The first one is the rapport. The second is the empathy. The third one we have the warmth, and the fourth one is the genuineness. So let us see in detail about each of the components. So first one is the rapport. So what is the rapport? So when the nurse and the client, they initiate the communication, they try to develop a relationship, or the nurse or the client will start sharing his feelings. So rapport is very difficult to establish. We cannot say, the first time the client comes, the nurse will talk to the client or communicate, the rapport is built. No. Okay, so it may take very less time, or it depends on the client and the nurse how well they communicate with each other, how well the client is able to initiate the communication. So based on that, the rapport will be built. So at times it may take a week or a month. So it depends on the situation. It depends on the individuals. So once the rapport is built, only then the client will develop the trust, wherein he will start communicating all his, feelings, or share or ventilate his experiences. So what is this rapport? Rapport is a relationship, or it is a communication which is useful and which is very harmonious. We can call as the willingness of an individual to become involved with the another individual. So that is called as the rapport. The next component is the empathy. So what is empathy? It is the ability of the nurse to feel with the client. Okay, keeping in mind, analyzing the situation, the particular event or the problems which is happening. Okay, the nurse will try to understand the client as his problem as her own problem. So that is called as the empathy. In the empathy process, the nurse receives the information from the client, and she will also keep in mind that, she will keep in mind that she uses the open, non-judgmental attitude when she is having this empathy. The nurse will communicate the understanding of the experiences or the feelings so that the client will be able to understand the situation. So that is the empathy process, which is very, very important. The next component is the warmth. So warmth is the ability which the nurse will use to make sure that the client feels comfortable and he feels safe to communicate. So it also shows that the nurse will accept the client, or is able to have the acceptance of the client. So that is called as the warmth. The last component is the genuineness. So what is genuineness? Is nothing but being one's own self. As a nurse, when she is communicating, the nurse should have or she should be aware about the various thoughts or the feelings, values, the beliefs that she has during the interaction process, so that it will not interrupt the communication, or it should not disturb the relationship with the client. So she has to be very genuine when she is talking or having a therapeutic relationship with the client. So this is all about the components of the therapeutic nurse patient relationship. Moving on to the therapeutic nurse patient relationship in detail. So we can say that the therapeutic nurse patient relationship is a cornerstone in the psychiatric mental health nursing, wherein the nurse will use her understanding, she will use the observation, and she will communicate with the client. So that is a very important thing. So we can say that the only weapon in the psychiatric mental health nursing is the tongue. Okay, so tongue does the communication. So through the communication, a relationship is built. Only when a relationship is built, it will help in the nursing process, especially in the mental health nursing. So what is this therapeutic nurse-patient relationship? So it is the mutual learning experience and a corrective emotional experience for the client. So in this therapeutic nurse-patient relationship, so both the nurse and the client will work with each other to achieve a particular goal. So we can say there are few things which the nurse will learn from the client, things with the client will learn from the nurse. So we can say it is a mutual learning process. And for the client, it is a learning process wherein his emotional experiences will bring about a change in the behavior of the client. The therapeutic relationship is based on the belief that the client has already got a potential, and through this therapeutic relationship this potential will grow to the fullest. So that is the belief of a therapeutic relationship when there is an interaction with the patient. So, as I told, the nurse and the client interact with each other, or they work with each other mutually to achieve a goal. And also, the nurse is an important person who will assist the client to understand about himself, so that he will be able to face the new challenges and will be able to lead his life on his own, which can lead to the personal growth of the client. So the interaction is purposefully established with the purpose that the client will gain the new coping skills to face the various life challenges. So that is about the concept of the therapeutic nurse-patient relationship. So there are certain ethics and responsibilities from the nurse's end when she is maintaining a therapeutic relationship with the client. So let us see what are the ethics and the responsibilities in a therapeutic nurse-patient relation. Ethics is defined as the branch of philosophy which involves the study of the values which are related to the moral standards of a profession. So that is called as the ethics. So let us see the ethics in detail. Yes, the first ethics in a therapeutic relationship is the ability of the client to make his own decisions, right? So we have to give an independence and autonomy to the client to make his own decision, to make his own choices. So that is the first ethics, that the nurse shouldn't avoid or shouldn't discourage the client to make his own choices or make his own decisions. Yes, you have to give the autonomy or the independence to the client to make his own decisions or the choices. The second ethic is the patient's right to beneficence. It is nothing but doing good by the nurse. So the nurse always has to keep in mind that the client's need has to be met. The goal of the client has to be met. So she has to do something good to the client. So that is the second ethics in the therapeutic nurse-patient relationship. The third one is the patient's right to the justice or the fair treatment. Yes, the patient has got all the rights to receive the treatment from the healthcare system. So the fair treatment should be given without any discrimination, without neglecting, ignoring the client. So you see to it that the patient has got the justice for the treatment. The next ethic, which is very important in the psychiatric nursing, is the nurses should always keep in mind to maintain the patient's dignity, the respect, the acceptance of the client based on various beliefs that the client has, the various values that the client will possess. So you should not discriminate any of the patients based on the beliefs, based on the customs, or based on the religion. Okay, you shouldn't be able to discriminate. So that is a very important ethic in the therapeutic nurse patient relationship. So the next important ethic is the nurse should be able to accept the patient by being non-judgmental in terms of the discrimination or the attitudes towards the patient. So very very sensitive issue that the nurse should always act as an advocate when she is caring for the client by being non-judgmental and non-discriminate. The next ethical principle we can say is the patient has got the right to participate and choose the proposed treatment. So there are various treatment modalities in psychiatry, drug therapy, or ACT, or various therapy. At the end of proposing the treatment modality, you have to give the freedom or an independence or a decision making process to the client to choose what is the treatment which is very much up to the client. So that kind of an independence that you have to give to make a decision about the choice of the treatment, whatever it is proposed. The last one is you always have to respect the patient's freedom. Yes, a patient is a psychiatric patient. Yes, the patient may not be having that intellectual ability to make the decision, but also you have to keep in mind the dignity, the respect, the individuality of the patient, to always give an independence, encourage and motivate the client in an acceptable way to make the choices and to lead his life in an independent way. So that is the ethics or the responsibilities in the therapeutic nurse patient relationship. Now let us move on to the phases of therapeutic relationship. So if you take the phases of therapeutic relationship, mainly we have got the four phases. The first phase is the pre-interaction phase. The second phase is the introductory phase or the orientation phase. The third phase we have is the working phase, and the final phase is the termination phase. So we have got the nurse's task in each of the phase. What are the problems which the nurse and the client will encounter during each phase of interaction, and how to overcome these problems. So that is what I'm going to explain now in detail about each of the phase. The first phase is the pre-interaction phase. So as the name itself says, pre-interaction, before the interaction itself, there are certain preparations from the nurse's end that she has to do. So what is this phase? So in this phase, the nurse is assigned to a particular patient. Yes, the assignment to a particular nurse is done, and she will review about her own self in terms of what she thinks, what she feels, what are the things that she has to communicate. So all those things are planned just before the patient comes for an interaction. So that is a pre-interaction phase. So what is a nurse's task in the pre-interaction phase? The first one is exploring her own feelings, the fantasies and the fears. So initially when there is a nurse who is, say for example, the nurse is a new nurse, okay, or a fresher, or even the experienced nurse, whenever she wants to interact initially with the client, okay, there are certain feelings or fantasies that the nurse may have, or the fear or anxiety that the nurse may have. So that is the first thing that she has to understand. So if she is able to understand her own feelings, strengths and weaknesses, she may move on in the therapeutic process. So first thing that she has to do is to explore about herself, her feelings, her fantasies and the fears and to keep in control all her emotions. Okay. The second one is analyze our own professional strengths and limitations. So she has to know as a nurse what are our responsibilities, what are the professional strengths, what are the limitations that she has to maintain. So that is the second nurse's task. The third one is to gather the information about the patient whenever possible. So she has to do a review about the patient. Say, for example, the patient is having a previous case file. So she has to analyze, she has to find out and do the assessment of the client before the client himself meets the patient. So she has to go through the report, she has to go through the case file, she has to go through the previous history of the patient, try to find out what is the name, the basic data about the patient, so that she will get an idea how to start the communication and try to find out the answer. So that is the third task of the nurse in the pre-interaction. The next task is to plan the first meeting with the patient. So she has to plan once she knows and reviews about the patient. Okay, she knows the baseline data of the patient. She has to plan the meeting with the patient. Okay, so when to meet, when to which, what is the setting that they can meet. So what is the goal that they have to set. All these things is the planning which is made before the meeting. So she has to plan for the meeting. So these are the nurse's tasks in the first phase. So what are those certain problems which will be encountered from the nurse's end when she is in the pre-interaction phase? The first one is difficulty in the self-analysis and self-acceptance. So if the nurse is not knowing or she's not able to explore her feelings, her fantasies, her fears, her anxieties, or if she is not able to have the ability to manage her own emotions, control her emotions, or say for example that she is not able to understand her professional strengths, she doesn't know what is her professional responsibilities, what are her limitations, then it is going to be a failure. So that is one of the biggest problem which happens in the initial phase of the therapeutic communication. What is the second thing? The second thing is the anger. So there are certain emotions from the nurse's end, like anger it can be, or the depression, or the fear, anxiety. All these are going to have an influence in the communication. The feelings of boredom and indifference. So these are the things which are going to hinder the process of communication. The nurses may not move forward for the meeting or for the interaction with the patient. So that is the problems which are encountered by the nurse in the first phase. Now, what are the ways that we can help the nurse to overcome these problems? Okay, we need to assist the nurse to overcome these problems. What are those ways? The first thing is she has to seek the help from the peers and also from the supervisors to analyze about her own self, about the situation. So when we have got our seniors or when we got our superiors, so when we encounter a problem as a nurse, we should always seek the help and assistance from our supervisors and the peers, so that they will be helping us out in the analysis and analysis part with the professional responsibilities that they will help us out. The second thing is she has to analyze or assess her own self. Okay, as much as possible, she has to know about her strengths and limitations. She has to know about her weaknesses. She has to know about her own self. Only when we are able to understand our own self, we'll be able to understand another person. So very important, she has to take time for ourselves to analyze about our own self, which is going to help us out in the treatment process of the client. So this is about the phase one, which is a pre-interaction phase. What are the problems which are encountered and how to overcome the problem. So moving on to the second phase of the therapeutic relationship, that is the introductory phase or the orientation phase. So as the name says, introductory phase and the orientation. So it's the first time here in this phase that the client and the nurse meet each other, right? So the nurse's concern here is to find out why the client has sought the help. What is the reason that the client has come to the nurse? Okay, so what is the concern of the client? That is the goal to be found in the introductory phase. So, what are the nurse's tasks in the introductory phase? The first thing is she has to establish the rapport, the communication, and the trust and acceptance from the client. Okay, so very important during the introductory phase, they introduce each other, they try to understand each other. Right. So during this process, the first phase wherein the rapport will be established, the communication will be established, the professional relationship will be established, trust will be established, and the acceptance from the nurse's end. Okay, that is the main thing that should happen during this introductory phase of the communication. The second task is to gather the data. Yes, so the data related to the patient, the information that we have to collect from the client in terms of the baseline data, what are the strengths of the patient, what are the weaknesses of the patient, why he has come, what is the problem with the patient. So basic baseline data is being collected from the client. So the next thing what the nurse has to do in this phase is she has to find out the problems of the client. Okay, she has to make the nursing diagnosis, make the goals, okay, prioritize the goals of the patient, and also plan the intervention. So these are the tasks which happens in the introductory phase. So very important in the introductory phase to develop the rapport and trust so that the patient will be able to ventilate his, give all the information, and it will help the nurse in the nursing process in terms of finding out the formulating the nursing diagnosis, setting the goals or the plan, and also for doing the priorities. So that is the nurse's task. So what are those problems which are encountered during the second phase of the therapeutic nurse-patient relationship? Perception of each other as a unique individual may not take place at all. Yes, the nurse herself may not perceive the client as another individual, or the client may not perceive the nurse as another individual. So, perception of the individuals may not take place. That is the one of the important problem which are encountered during the first phase. They may not share about each other. Right. The second problem which is encountered is establishing an agreement. Yes, so here they may fail to establish an agreement in terms of setting the goal, in planning the treatment, or because there is a failure to understand each other, perceive each other, so the goal or the plan for the treatment also may fail, or the agreement as to reach a particular goal or solve a problem can fail. Okay, so that is the second problem which is encountered. So, what are the ways to overcome the problems during the second phase of the relationship? The first thing that the nurse can do is she can share her thoughts or relate her ideas with her superiors and seek the help from the superiors as to how to move about in this kind of a process. The nurse must feel free to reveal about herself without keeping in mind about the self criticism. Yes, without keeping that idea about the self criticism, nurse should be able to analyze her own self and should be able to share her whatever ideas or feelings she has honestly with the superiors. Okay. One more important thing is the counter transference from the nurse's point. Yes, so what is this counter transference? So, as an individual, there are many feelings or emotions which are unconsciously pent up in the mind. So, as a nurse, also, there are many feelings and thoughts which are unconsciously present in the nurse. So, this may be communicated. So, this may be communicated to the client. So, as a nurse, how to overcome this? So, such kind of a counter transference or a feelings that she has, unconsciously, these things has to be solved first, so that she can seek the help first before that she will initiate the application. So, counter transference is the one more thing that has to be overcome by the nurse's end, so that the therapeutic relationship is better. So, At times, it may be a failure from the nurse's end to identify her own self in terms of the countertransference. So, at that time, it becomes the responsibility of the supervisors or the seniors who are there to identify that the nurse is having this particular problem or the countertransference, and also communicate and deal with it in a appropriate way. So it becomes a responsibility of the seniors or the supervisors to assist the nurse to overcome this problem. So moving on to the third phase of the therapeutic relationship, which is the working phase. Most of the therapeutic work is carried out in this phase, which is the working phase. So the therapy, as this the name says, the treatment process is usually carried out in the working phase. So here in this phase, the nurse and the patient will try to explore the various stressors, okay, which is a problem to the client, and they will try to analyze this stressors and try to overcome these stresses. This will help them in developing the insight, right? So the main task in the working phase is to identify the various stresses and also help the patient to have the development of insight to become aware about these problems and also solve the problems. So that is what is happening in the working phase. So let us see what are the nurses task during the working phase. In the working phase, okay, so we as a nurse should gather the further information and relevant information which is very much required. So you know, in the initial phase, the pre-interaction phase, what happened? You have gathered the basic information, you have gathered baseline data. So in the working phase, you're going to build on the data whatever you have at base, right? So you're going to learn more about the patient here. You're going to find out in detail about the patient's concern. Okay, so that is what is gathering the information in detail relevant or appropriate to the situation of the client. Once you have gathered the information, you have to assist the client in helping him to promote the problem solving skills to cope up with the various stresses. So you're going to use the various coping mechanisms, you're going to give the various therapies to help the client to overcome the problems, whatever he is encountered. The next thing, you're going to bring about the modification in the behavior. So what are the changes in the behavior which will happen? You have to evaluate even that. So you have to help the client facilitate the modification in the behavior and also evaluate and find out the result of the change in the behavior. Why a person is behaving in this way? Okay, what is the reason for exhibiting this kind of a behavior? What are the ways to overcome, cope up? And how is the result when the patient is coped up with a particular behavior, is learned a new behavior, modified his behavior? What is the result of this kind of a behavior? So that is done in the working phase. You're also going to provide an opportunity to the client to have an independent function. So once all these problems are being identified, you give the various coping mechanisms, you teach him to overcome the stressors, you modify the behavior of the patient to find out what are the result of these behaviors. You have to help the client to have this independent function. So that is all overall thing which is the nurse's task in the working phase. So let us see what are the problems which are encountered in the working phase. So since the working phase will take a longer duration of time, okay, this is the phase which happens for a longer duration of the time. Even the problems which are encountered during this phase are more. So what are those problems which are encountered? Let us see. The first one is testing of a nurse by the patient or the client. At times when the nurse is working with the client, okay, usually they are working to reach a goal. At times the patient will test the nurse in terms of the ability of the nurse to help him out in solving the problem, ability of the nurse to help the client in using various coping mechanisms, ability of the nurse to to control her own self, her own emotions, and to avoid the punishment to the client. So all these things will be tested by the client. So that is one of the very important problems which are encountered in the working field. The second problem which is encountered is unrealistic assumption about the progress of the patient. So what is this unrealistic assumption? So at times when the nurse, when she is working with the client, she may just assume whether the patient is, progressing or is there any kind of improvement in the behavior. So at initial period of time in the beginning, okay, there may be a improvement. See, as a nurse, she can see some changes in the behavior of the client after giving the intervention. But after that, later on, what happens? There is a time when the nurse can see that the behavior is static. There is no improvement at all. There is no progression in the treatment. Right. So at that time, the nurse can feel discouraged, or she may feel lethargic to help out or reach the patient. So that is unrealistic, assumption of the nurse that the client is not progressing, and she may feel discouraged to move on in the treatment process. That is the second problem which is encountered from the nurses end. The third one is the nurse's fear of closeness. So during the working phase, there is a kind of a therapeutic relationship which is developed. So at this point of time, there is a fear from the nurse's end that she is going to become very close to the client. Yes, so there are certain relationship that the nurse can develop, the feeling of closeness or affinity towards the client. So when she analyzes that, she finds out that she may try to avoid or limit the interaction, or try to keep a distance from the client, ignoring the client, which will again disturb the treatment process. Right. So that is another important thing. When the nurse tries to know that she is becoming closer to the client, she may fear that the relationship may take other way around. She may avoid talking to the client or helping the client, assisting the client, which is again going to make a discouraging thing to the client. The next problem which is encountered is the life stressors of the nurse. Okay, as an individual, even the nurse has got various, stressors or anxiety within herself. Okay, if she is say a personal life is going to have an disturbance in the professional life, right? Obviously, she may not be able to concentrate. The care may not be delivered effectively. So there are certain life stresses for the nurses which can also hamper the treatment process when she is giving a care to the client. So that is another factor which is a very important thing which can happen in the working place. The next problem which is encountered is the resistance behavior. So what is this resistance behavior? It is from the client's end, right? So at times the client will resist a particular interaction or the working with the nurse. Okay, he may feel that the working phase is taking too long. He may feel that he will not recover very soon, or whatever the treatment is given is not going to help him out. So he may feel very lethargic. At times, he may feel discouraged about the therapy, or because of which he may, come late to the therapy sessions. Okay, he may forget that there is a session for him, or he may not show any kind of an interest in the therapy. Okay, so such kind of a resistance to avoid the working together in a therapy can also be an important problem which is encountered in the working phase. As I told you, working phase is a very long duration it may take. So because of which the client may not have that much patience to, deal with all this. So he may become lethargic if it is not working very quickly. So that is a resistance from the client end, which can hamper the therapeutic relationship. The next problem which is encountered is the transference. So, what is this transference? So, even the client has got so many things in his mind. He has got various stresses, various feelings, or thoughts. All these can be expressed towards the nurse in the treatment process, right? So, it can be ventilated. So, it can be unconsciously projected towards the nurse during the working phase. Okay, it can be the anxiety, it can be the various emotions like anger, hostility, okay, depression, sadness, all these can be projected towards us. Okay, so that is called as the transference, wherein the unconsciously all the feelings or expressions or experiences can be projected towards us, when the nurse may not feel encouraged to help out the client to reach the next problem which is encountered is the countertransference. So here the countertransference, even the nurse, based on her previous experiences, she may have lots of anger, fear, hostility, or various emotional changes that she may project towards the client during the therapy process. Here again, the client may not feel good about the nurse, so the working phase may not. So these are the problems which are very much important, which is encountered during the working phase of a therapeutic relationship. So let us see what are the ways to overcome these problems. What are the ways? The first one is the nurse can involve herself in the various conferences or group discussions with the superiors or the supervisors and with the other staff. So, in that particular conference or the workshop or in the particular seminar, they will teach the nurses how to deal with such a kind of a situation, how to overcome these problems, how to have control over our own feelings, right? So these will be taught by the supervisors or by the other staffs who are in the group sessions, in the conferences or in the workshops, which are really going to help the nurse in the care of the patient. There are times when a nurse believes that, no, she feels that the treatment process may not progress at all, or she may not be able to handle the resistance which is happening from the client's end. So at that times also that she has to overcome such kind of a problem, that they can communicate during the conferences, which wherein they may get many suggestions, many ideas from the other staff, which are really going to help out the nurse in the working phase. So moving on to the last phase, which is the termination phase. So as the name says, termination, it is going to come to an end. Therapeutic relationship is going to come to an end. So we can say it is the most difficult phase in the therapeutic relationship, and also it is the most important phase of a therapeutic relationship. So what is the goal of this phase? The goal of this phase is to end the therapeutic relationship, as I told you. So what are the nurse's tasks in this particular phase? The first one is establish reality of separation. So here the nurse as well as the client, they have to understand that the reality of separation, that at end of the working phase, okay, they need to understand once the problem has been solved, once the treatment has been covered, they have to separate, they have to part apart. Okay, so that is the reality that always the nurse and the client should be able to analyze and establish. So establishing the reality of the separation. The second task is the mutually they may share certain feelings. Okay, so it can be the feelings of sadness, feelings of anger, hostility, feelings of rejection, and other related behaviors that they mutually share, that they may carry out from each other. Okay, that is another important task, or important thing that you have to keep in mind, that they may mutually share these feelings of sadness or anger or the changes in the behavior. Yes, the third task is the nurse has to review the progress of the therapy. Okay, and also see to it whether the goals what they have set has been achieved or not. So review the progress of the therapy. How was the patient when he came? So how was he on the second day? What is the progress in the patient's behavior? Is there a change in the behavior, modification in the behavior? behavior. So whatever the nursing process, the goal which was set, whether the goal has been achieved or not, that has to be analyzed and evaluated by the nurse. The next thing is based on the achievement of the goal. Okay, she has to plan for the future needs of the patient to be met. Yes, whether the client requires another session of the therapy or whether the client requires more help. So based on evaluating the overall progress of the patient, the nurse will be planning the future meetings. So that is another important task which happens in the termination. So what are those problems here in the termination phase which will be encountered? One thing is the anger. So why there is an anger? Maybe the goals won't have been met. There may not be an cooperation from the client, or the nurse's attitude may not be the approachable one to the client. So because of all these, there may be a anger from the nurse's end or from the client's part. That is one of the problems which are encountered. The second one is the punitive behavior. So what is the punitive behavior? As I told you, at times the client may test the nurse for the patients and for the ability of the nurse to avoid the punishment. So here in the termination phase, they may have a problem that the nurse may exhibit the punitive behavior, like in terms of neglecting the needs of the client or ignoring the client, or not continuing the therapeutic relationship with the client. So these kind of a problem can be encountered in the termination phase. Okay, and unexpectedly they may discontinue the therapy. Okay, so that is the reason why there may be a punitive behavior towards the client. The next one is depression, or assuming the non-caring attitude. So at times when the client is not progressing, okay, or when the nurse is not seeking towards the client, helping him in solving the problems, encouraging him, there may be depression, and also there may be assumption that there may be assumption of non-caring attitude from the nurse's end. Okay, so all these can also be a problem in the termination phase. The next one is the flight to health. So what is this flight to health? The client, okay, whenever the client feels that the therapy is not going to work, okay, where he feels that the relationship with the nurse is, the rapport is not established, the trust is not established, communication is not established. So obviously the client feels that this kind of a relationship, or the nurse may not be able to deliver whatever the expectation the client had. So at this point of time, the client may feel that to discontinue the communication or the relationship, he may just act as if that he has got the complete health or he has recovered. So that may seem that the client may have a flight to health. Okay, that is another problem which is encountered. The next is the flight to illness. What is this flight to illness? So here the nurse will feel that the client has not progressed, right? So how much ever she tried from her end, okay, so whatever she had done, the problem solving skills, the informing skills that she had given, in spite of that, the progression in the health of the client has not happened. So the client may not receive the treatment or expectation. So that is what the nurses may feel, that he has not progressed at all. That is another thing which is applied to the illness. The last problem which is encountered is the inability from the nurses end to plan the accurate treatment. There may be unwillingness to make a specific plan and implement from the nurses end because of various reasons, right? So that can be another problem which is encountered in termination phase. So what are the ways to overcome these problems? So one thing is the nurses should be aware about the client's feeling and also what are the ways to overcome these problems or the feelings. So that is the first thing to overcome the problem. So nurse should be able to understand completely about the patient's feelings, should be able to have the empathy, right? So that is the one. The second thing is the preparation from the client's point of end to end the therapeutic relationship. So always the nurse and the client should keep in mind that the relationship is not going to be forever. At time, once the therapy is completed, they have to end the relationship. So the nurses should openly elicit and communicate to the client that the relationship will not be continued and he has to move on and solve the problem by his own self. So that is the main goal here, wherein the client has to be independently able to function, right? So the nurse should be able to communicate this, and also she has to encourage the client to express what are the feelings that the client is having at the termination. At times, the client may not be ready to move apart, right? So the nurse always has to remind the client that he has to deal with the problems independently, and also nurse has to encourage the feelings that the client will have at the termination phase. The last thing is the supervisor. The role of a supervisor is to assist the nurse to make sure that the overall treatment process is completed, there is a progression in the patient, and the plan for the discharge is being made. So, which will also include the need whether the patient has to come for the next session, future needs to be met. So, all those things can be planned in the discharge plan. So these are the ways to overcome the problems in the last phase, which is the termination phase. So very important in the therapeutic relationship that the nurses will have the process of encountering into all these phases, from the pre-interaction phase, the orientation phase, the working phase, the very long phase, and the termination phase, various problems, various ways to overcome the problem, very important, so that the needs of the client is met in effectively, and the overall goal here is to see to it the patient is able to function independently by having the awareness about his own self, right? So this is all about the therapeutic nurse patient relationship. Hope you all have understood the topic. Thank you.